Hello to all our travel advisors. It's Richard again, sending you end of August greetings from all of your friends here at the Royal Caribbean Group. It's hard to imagine we've been working from home for over 5 months now. Absolutely unbelievable. No matter how you slice it, 5 months is a long time. I was actually impressed to see an ad from 1918 from Bell Telephone during the flu epidemic of 1918. It touted the then new technology of the telephone, and it talked about how it could keep people in touch. It sounds very much like what we're doing today with video conferencing. Now, I admit it's nice to see people face to face on the screen, but there are some days where I feel like I'm spending half my time clicking the mute button on and off. Regardless, this experience is going to have a profound effect on how all of us view the workplace in the future. Clearly, remote working has some advantages as well as some disadvantages, and there are going to be some real changes as we move beyond COVID-19. Things won't always be this chaotic, but I know there are days that seem that way. Again, this too shall pass. And when this pandemic is behind us, we will all be left with the lessons we've learned. We will be better cooks, better hairstylists, and I think better business people. Maybe during this lousy stretch of business, you've gotten better at controlling costs. Maybe you've built better relationships with your clients. Maybe you've gained some perspective and self-awareness. So we're not through this yet, but there are more bright spots and bits of good news than there have been for quite a while. We are closer to the other side of this crisis every day. It's also encouraging to see cruising starting up in other parts of the world. In Germany, our joint venture company, TUI Cruises, has been operating cruises since late July. In Italy, MSC Cruises started operating last week and has attracted a lot of really very positive publicity. We understand Costa Cruises is starting operating there in just a few weeks. While these are still only a small sample, we have always said that we would restart slowly and methodically, and we're going to learn from these early efforts. And at the same time, we have a new expert here at Royal Caribbean who plays a critical role in helping us understand these changing circumstances and how we can best address them. His name is Dr. Calvin Johnson, and he is our new head of public health and our chief medical officer. His title is longer than his name. He has an interesting background, and I thought you might enjoy hearing directly from him and hearing some of his insights. So Calvin, welcome. Perhaps you can begin by telling us a little bit about your own history and how your path led you to the cruise industry.
Well, thanks, Richard. It's a pleasure to be here and talk with you about this. You know, my path here probably started in med school. Where I went to school at Johns Hopkins, there was literally a school of public health across the street. And that's where one day I kind of discovered this world of population health and preventive health and health policy. My first real job was actually, after residency, was actually in New York City in the public health department. And that's where I learned the real essence of public health. And so my path from there led me to be a medical school professor, and then had the opportunity to serve as health secretary, running the health department in a large state of Pennsylvania. And from there, private sector opportunities, leadership opportunities in large healthcare centers and private healthcare organizations kind of all prepared me from a health leadership perspective and a public health and healthcare perspective to land here at your doorstep.
Well, I'm glad you've accepted the position, and now that you're here and you've been doing the job for a while, can you tell me what convinced you to join Royal Caribbean?
I'll tell you, Richard, when I first read what you were looking for in a leader for your public health and chief medical officer, what I saw was the opportunity to apply my skills and experience in a really meaningful and substantive way during one of probably the most significant health crisis of our time. It's the nature of the work. It's the opportunity to serve 75,000 crew and protect their health. It's the opportunity to serve, 4 to 6 million guests a year, all focusing on protection of health and and public health.
So, Calvin, one thing that's happening recently is we're hearing more and more from medical and scientific updates about combating this virus. Can you take us through some of the basics? What's new in testing and in therapies, and what's happening on the vaccine front?
Sure. Well, let's start with the vaccines, because that's probably what's most anticipated and what people are hearing a lot about right now. And vaccines, as we know, are compounds that are taken kind of typically by injection. But what they do is they stimulate our bodies to generate an immune response, to be defenses against infectious disease and infectious agents like this coronavirus. And so while vaccines are not an overnight bullet, they certainly are a game changer in terms of protecting us and protecting the individual, the vaccinated individual, from becoming infected and spreading disease to others. And so right now, there are a number of vaccine candidates that are in what's called clinical trials. And those are the scientific studies and tests of safety and their effectiveness that go through a few different phases to see and make sure that, one, they won't hurt people when they're taking their effect in us, and two, that they'll be effective in getting our body to generate an immune response to protect against, in this case, the coronavirus. If we talk about the type of tests that are out there, testing is actually a very important tool in terms of coronavirus, both in terms of diagnosing it and in terms of helping us to contain the spread. Once we know that someone does in fact have this virus and is confirmed through a test, then we can go about identifying who they may have been in contact with, who may have been exposed to it, and begin to stop the spread. So that's very important. And so there are a couple of types of tests. One is what we call a molecular test, and that's the test we hear a lot about, this PCR or polymerase chain reaction test. And that's a test that gives a pretty good indication that if you've got the virus, it's going to tell you you've got the virus. There's also tests called antigen tests, and those pick a particular aspect of the virus, a protein on the virus, and identify that. And then the third are called serology tests. Those are the antibody tests we've heard about. Not really good for diagnosing coronavirus infection, but they can tell down the line if, in fact, someone may have been exposed or may have had the infection in the past. They're not as reliable, but every day, all of these tests actually are getting more and more reliable as technology improves.
And this new test that we're hearing about, this ability to do it based on saliva, that will really be a game changer, because it's fast, it's easy, and it'll be allowed us to do so many tests that we can really get this thing under control. Some people are calling it a pseudo vaccine.
Yeah, and again, this speaks to the rapid advances in technology that we've seen in this era of this pandemic. So if there's a bright spot you want to try and find in this really difficult time that we've been having, it is that technology has really advanced remarkably and has come up with some results like this, some of which we're going to see most likely kind of come into market and being available to us in relatively short order. And this saliva-based test is one where it's not very invasive to get it. It really relies very much on saliva and as the sample that's used, and we expect it'll be increasingly accurate over time.
I know you've only been here for a little short time, but are you already seeing elements in the way we approach medical care that are strengths that you want to build on, and are there areas that you already can tell you want to approach in a different way?
Well, as you indicated, Richard, I'm learning a lot every day. It's an amazing organization, a big organization, a lot going on, and with this incredible singular focus that we have on getting back to sailing in the way that you described, in a safe, safe way, making it as safe as possible for our guests and our crew. It's been really fascinating. One of the things that really intrigues me and I see as a real opportunity to really advance care and what we do, both on the medical side and on the public health side, is to use technology to advance our cause, and particularly in the assessments of health and health status, and in terms of gathering data. Data collection, as we've seen throughout this pandemic, is a critical element to better understanding both this virus and medical conditions in general, and then being able to apply that knowledge to the advancement of health. Another area, Richard, is analytics and using that data in a way that really informs us about how we can improve and be more efficient, whether it's our public health inspections or whether it is, again, delivering direct care, all focused on preventing illness primarily, but certainly recognizing it early and preventing those negative outcomes.
So I think you can all see why we're so glad to have Dr. Johnson aboard with us and why we're already grateful for his expertise and his insights. Calvin, I'd like to thank you for joining us. And, I normally close these notes to our travel advisors with a few last words, but I think today they may have more impact if they came directly from you.
Happy to oblige, Richard. Thank you all for joining us. And as Richard would say, wear your masks and wash your hands.
Thanks, Calvin.
Thanks, Richard.